Hello and welcome. We're pleased to welcome people from all over the world that have joined us to take part in a conversation about well-being and symptom management in progressive MS. We're going to be discussing strategies that can help improve your life today, and we'll be talking about how researchers are working on new life-changing solutions. My name is John Strom, and I'm joining you from Los Angeles, California, in the United States. I'm a volunteer for the International Progressive MS Alliance. The Alliance is an unprecedented global collaboration of MS organizations, researchers, health professionals, pharmaceutical industry, companies, trusts, foundations, donors, and people affected by progressive MS, working together to address the unmet needs of people with progressive multiple sclerosis. In short, the Alliance has gathered the best and brightest minds in MS to solve progressive MS. Our work is funded through the generous support of donors throughout the world. As a volunteer, I have the honor of serving on the Alliance's Scientific Steering Committee. My wife, Jean, has lived with progressive MS for over 20 years, and she's severely affected by this complex, challenging, and difficult disease. My role is to bring the perspectives and voices of people affected by progressive MS to every aspect of the Alliance's research and work, ensuring that we're always focused on where the most life-changing impact can be achieved. I also host Real Talk MS, a podcast that shares information and tools to help people affected by MS live their best lives. You can find Real Talk MS online at realtalkms.com or wherever you find your favorite podcasts. Today, we want to talk about some of the most challenging symptoms in progressive MS: fatigue, cognition, pain management, and mobility. And when I say mobility, I mean the movement of both our upper bodies and lower bodies. Joining me today are some of the leading MS experts in these areas. Let me take a moment to introduce them, and then we'll jump into the conversation using questions that many of you submitted. So joining me today are some of the leading MS experts in these areas. Let me take a moment to introduce them, and then we'll jump into the conversation using questions that many of you submitted. We'll also follow your Facebook comments and try to incorporate them throughout our time together, as well as provide you with some online resources at the end of our program. Dr. Jenny Freeman is a professor of physiotherapy and rehabilitation within the Faculty of Health and Human Sciences at Plymouth University in the United Kingdom. Her research focuses on complex rehabilitation in MS, with a key focus on keeping people as physically active as possible. She also serves as a lead in the Progressive MS Alliance's Well-Being Strategy Implementation Team. Dr. Freeman is joining us from her office in Plymouth, England. Dr. Stefan Gold is a Heisenberg Professor of Neuropsychiatry in the Department of Psychiatry, Charité Medical School in Berlin, Germany. His research has focused on complex symptoms in MS, including depression. As I was saying, Dr. Stefan Gold is the Heisenberg Professor of Neuropsychiatry in the Department of Psychiatry at Charité Medical School in Berlin, Germany. His research has focused on complex symptoms in MS, including depression, cognition, and fatigue. Here he examines biological causes in order to improve existing treatments and to discover novel interventions to manage these debilitating symptoms. Dr. Gold is joining us today from Travemünde at the Baltic Sea. Dr. Dawn Eadie is a psychologist and holds the Nancy and Buster Alvord Endowed Professorship in MS Research in the Department of Rehabilitation Medicine at the University of Washington Medicine. She conducts clinical trials evaluating non-pharmacologic interventions for chronic pain, fatigue, and other symptoms affecting people with MS. And Dr. Eadie joins us from Seattle, Washington, in the United States. The symptoms of fatigue, mobility, cognition, and pain are complex, and they can prevent people with progressive MS from enjoying daily life. I'd like for each of you to share one thing that research has discovered that people could do right now to better manage these symptoms. Dr. Eadie, what is one thing we've learned to better manage pain?
Well, thank you. We've learned that pain is complex in people with MS. And although that might be frustrating and sound a bit intimidating, really what that means is there are many different ways that people can manage their MS. So I guess if I were to pick just one thing, it would be that I would ask people who have pain and progressive MS or MS of any type to really think about different strategies and to have an experimental attitude about trying different kinds of strategies that we'll be discussing in more detail today to really put together a toolkit to deal with pain.
Thank you. Dr. Freeman, what can someone do to improve their mobility, even if they're using a wheelchair?
Okay, so there's overwhelming evidence to show that strengthening and aerobic exercise can really help to improve people's mobility, as well as a range of other symptoms such as fatigue, etc. A number of studies have been undertaken also evaluating a really wide range of different types of exercises like cycling and walking or yoga and Pilates, balance activities, and they can all be adapted to suit people who are ambulant and for people who use a wheelchair as well. So trying to exercise as much as you can, doing exercise that you enjoy, starting small and graduating it is certainly one thing that you can do for mobility. Sometimes poor balance can really interfere with walking as well, and so using walking aids like sticks or maybe trekking poles outdoors or crutches or a frame that mean that you can keep walking safely and with confidence is really important, because that in turn means that you can walk for longer distances usually, or maybe for more time, and that too keeps you fitter and more mobile. And there's a whole range of devices like foot drop splints or functional electrical stimulation, which can also help with things like foot drop that so many people experience and can cause them to fall and perhaps lose confidence and put you off walking as well. And a lot of those kind of devices can be easily purchased over the web, and they can make a really huge difference to preventing slips and trips and falls and reduced mobility as well. And of course, people in a wheelchair can look at things like the heaviness of the wheelchair, or whether it's manual or electric, and that can make all the difference as well to people being able to push themselves or maneuver themselves in wheelchairs independently.
Dr. Gold, fatigue seems to be a universal challenge for people with progressive MS. What can help address fatigue today?
Okay, well, thank you. So I think one thing that we have learned is that what people experience as fatigue has different components, and each of these components might be linked to a different cause. So even if it feels like it's one symptom, it's usually a combination of different factors that are contributing to it. Now, some of it is related to the biology, to biological changes that are happening in the brain due to MS. And ultimately, what we want is drugs or any other treatment that directly address this part. But that's only part of the story. There's always other components that contribute to this feeling of fatigue that might be more directly and more immediately be addressable for people in their daily lives. And I just want to give you a small example. For example, then sleep is one thing. So tiredness and fatigue is not the same thing. But if you're tired, it makes your fatigue even more draining and burdensome in some respects. So improving sleep, and there's certain things that you can do to get more rest during the night, will certainly help so not have on top of your fatigue additional things that make it harder to achieve the things you want to achieve in your day. And I think these are a couple of things that people can do. A lot of it is about trying to understand what kind of fatigue they're experiencing and under what circumstances it gets worse or better, and trying to tweak these circumstances a little bit, trying to find out what is it that gets in my way to sort of already alleviate some of these symptoms until we're making more progress understanding what the underlying biology really is.
Well, thanks everyone. Now I'd like to dig a little deeper into each of these symptoms. Dr. Eadie, tell me, how has our understanding of managing pain in MS changed or progressed?
Well, fortunately, we've come a long way since I started my career in MS. I can still remember 20 years ago or so where patients would tell me that they were told that MS is a painless disease, that there's no pain in people with MS. And it really was not getting much attention. And I'm very glad to say that there's a lot of attention, including the fact, or as evidenced by the fact that we're talking about it today. We know that MS, there's a high rate of pain in people with progressive MS. Probably around 70% of people have pain at least some of the time. We also know that it's complex. It comes from changes in the brain due to the MS disease. It comes from changes in how people move and get around. When people have difficulties with mobility, for example, it makes it harder to be active, which can in turn cause more pain, such as back pain. The good news in all that is we know there are also many new strategies that we can use to help people better manage their pain, to both decrease it as well as to change how it impacts their lives. And I think the really exciting thing is there's been a lot of attention paid in recent years to rehabilitation strategies, things like physical therapy and physical activity, and adapting those to people with potential mobility impairments and pain. And also looking at non-pharmacological treatments, such as teaching people different kinds of mindfulness meditation or self-hypnosis skills or cognitive behavioral therapy, or helping people to use this knowledge about how the brain plays an active role in pain management, and using that to help people really dampen down the pain signals and dampen down how pain is experienced, in hopes of really living more fully with MS.
Well, that kind of brings me to our next question, really, because, you know, pain is a symptom that I call a stopper. It gets in the way of being able to fully engage with life. So what kinds of things can people living with progressive MS do to better manage their MS-related pain, and what's on the horizon when it comes to pain management?
Yeah, you're absolutely right, John. Pain can be really something that gets in people's way. And some of our treatments, certainly we hope, really go after decreasing or getting rid of pain. But because pain is complex, unfortunately, we don't have at this stage drugs or treatments that can just wipe it out in all cases. And so we really have to help people also learn how to decrease the pain and decrease its impact. So there's a lot of research going on looking at these different ways, things like, as I mentioned, maybe teaching people some relaxation skills, or teaching people mindfulness, or getting them physically active in ways that are safe and that they can do, and really honing in again on how can we help you live a full life despite that. And just as one example that comes to mind, in a recent study we did, we talked with people afterwards about what they learned, what was helpful, what wasn't helpful. And one person said it best when she said that by learning some of these skills, she said, pain doesn't stop me from living my life anymore. And that is really the goal of the research we're doing here, and the goal of what many other people are doing.
You know, we actually have a question that's been submitted from someone who's watching in Australia. And they'd like to know whether there are any programs that they can access on their computer that might help improve cognition. Dr.
Great.
Eadie,
Do you want me to try that? Okay. Yeah, that's a great question. Certainly there, in the resources that I believe we're going to be providing you at the end of this, we have a couple things mentioned there, and one of them is a web-based program called My MS Toolkit, and it talks about especially managing pain and fatigue, but some of the strategies there are also things that you can do to manage cognition. And that reminds me of an important point I wanted to make about managing really any of these symptoms. The good news, I think, is that we're learning that for this complex condition of progressive MS, that probably the best care is going to be when we look at combinations of treatments. So not just using one treatment or one strategy or tool, but really looking to combine things. And the good news is some of these tools also can address different symptoms. So one thing like, for example, physical activity, as you've heard, it can help mobility, it can help fatigue, it can help pain, it can help cognition. And so learning you know, those kinds of strategies where you can really get kind of more bang for the buck, so to speak.
Well, let me ask you, when it comes to your research, can you tell us a little bit about what you're working on?
Yeah, we're really focused on looking at non-pharmacological treatments, and in particular, looking at how can we teach people pain management skills that they can do from the comfort of their home and their community. And so we're using strategies to deliver these skills via video conferencing. So for example, in one study funded by the National MS Society that we have going on right now, we're getting groups of people with MS, including progressive MS, together. And we're doing a video conference much like this, where a leader teaches them mindfulness-based cognitive therapy, which is a type of therapy we think holds a lot of promise, and cognitive behavioral therapy, so 2 different treatments, and teaching them these skills. And also they learn from one another because they're doing it via video conference, and they're doing it from the comfort of their home, so they don't have to spend energy to get to the treatment center or not be able to get it because they live too far from an MS care center.
Well, that sounds really great. Thank you. Dr. Freeman, as people notice that their mobility is being compromised, they often see it as it's kind of a done deal, something that really can't be improved upon. So can mobility be improved or preserved longer? And if it can, how?
Well, firstly, I really believe it's not necessarily a done deal at all. As mobility deteriorates, what happens is people become increasingly sedentary, and that in turn leads to deconditioning of the muscles, which means they become weaker because they're not being used. And the joints get stiffer, and the muscles get stiffer as they're no longer being moved as well. And alongside this, cardiovascular fitness all reduces. Well, we call those secondary complications. They're not complications directly because of the MS. They're an indirect result because of moving less and using the muscles less. So, but the thing is, they're a really important contribution to mobility deterioration. And these are the kind of things that are more reversible. Muscle weakness and stiffness resulting from that kind of disuse can be improved. And that can help the strengthening, but it also can help with walking and movement of the upper limbs as well. So one of the things, for example, I always ask people in clinic is about how much time they're spending sitting down. And often when they think about it, they're really quite surprised at the very small amount of time that they're being physically active. And so I ask them to think about different activities that they could do, just small activities to start, which really increase that level of physical activity. Sometimes it might be that they do some balance activities each time they boil the kettle, for example, which is a couple of minutes. Or perhaps it might be that they peel the vegetables for their upper limbs, even though it's quicker and easier for the carer to do that. And by doing that, you're using the muscles and using the joints more often, intermittently and each day, and that's a good way of trying to preserve mobility and upper limb movement as well as much as possible. Of course, you can undertake exercises as well, and physios, etc., can give you long lists of exercises, but you can also kind of really build that physical activity as much as you can into your daily life. And I think that's a really important thing. Even easy things like a pen gripper, which means that now you can hold the pen, and then maybe you can build in activities like colouring in or writing, or activities such as that, things that will mean that you continue to use your hands rather than stop doing it and therefore get disuse as a result. So I think there are all sorts of ways that people can improve their mobility even when disability levels can be quite high.
You've led some important research on the use of a standing frame in MS rehabilitation. Can you tell us, what have you learned?
Yeah, well, we were really excited about it. We undertook a randomized controlled trial that looked at the use of standing frames, and this was in people with progressive MS who were quite severely disabled. In the trial, about half of the people were allocated to standing in what's a portable wooden standing frame that they can use they use within their home, and that this frame provides them with support at their hips and their knees and their ankles, so they kept standing for much longer than they would be able to naturally, but also in a good upright position as well. The other half didn't receive the standing frame. And what we found that in the people that were asked, they were all asked to stand for 30 minutes, 3 times a week at least. And the vast majority did that. And those people actually found that aspects of their mobility improved, things like their transferring or their sitting balance and standing balance, their ability to move their legs to a degree, and in some people their walking improved as well. And alongside that, and that was objective measurements that we undertook for there, but alongside that we also asked people to make an audio diary of their experience of using the frame. And the message we heard really loud and clear with that was that firstly many of them really enjoyed standing in the frame. For some people, they said it gave them a new lease of life. They talked about the positive changes it had experienced in things like their self-esteem, but also other people noticed changes in their bowel and bladder function, for example. And they also told us that, and their carers told us that it was feasible for them to do this in their home. They could that was shown by the fact that 2/3 of them still were regularly standing in the frame six months later. So for people who find it particularly difficult to do some other forms of exercise, this really did open up forms of exercise for them, which they felt was really beneficial and was shown to be beneficial as well.
Dr. Freeman, can you tell us, where do you see rehabilitation for progressive MS heading? What might future treatments look like?
Okay, so there are a few avenues that I think about. One thing that I and many others feel quite passionate about is that even more of a focus on health promotion, I think, because it's now recognised that people at every stage of the condition, whether they're in a more progressive phase or not, need to keep as healthy as possible through diet and being physically active, not smoking, drinking in moderation. And I think the professions are putting much more emphasis on that, which is really important. And that means that actually people are better able to preserve their function as well if they have better reserve. I know there are a few issues with technology today in terms of Facebook, but I think that increased application of health technology is an obvious one as well. So Dawn talked about the use of being able to use distance-based measures like this or webinars to try and implement interventions so that people are in their own homes. Telephone-based coaching has been demonstrated to be useful for increasing people's physical activity as well. And then there are more sophisticated technologies, at one end of the range, things like robotic technology that can be helpful in terms of, particularly for those people with more severe disability, but, cheaper forms of technology as well, such as environmental aids. Even think about things like mobile phones and Alexa, how much more that can enable people to communicate, to access things they enjoy, like, communication and memory aids and music and all those kind of issues that can help in terms of rehabilitation with people.
When it comes to your research, can you tell us a little bit about what you're working on?
Okay, so there are two projects particularly that I'm working on at the moment. One is called CogX, it's cognition and exercise in people with progressive MS, and that's looking at the effect of cognitive retraining on a computer, either alone or in combination with physical exercise, and seeing if that can improve cognitive function in people with progressive MS. That study is a real breakthrough for rehab because it's a very large multi-centered study. It involves 6 countries and 11 centers, which is a real movement forwards in terms of rehabilitation studies, which hasn't been possible before. The study itself is funded by the Canadian MS Society, but the Progressive MS Alliance was also really pivotal in trying to enabling people to network and get together in the first instance to develop the grant. The second study I'm involved in is a randomized controlled trial looking at vertigo through vestibular rehabilitation. So people can often feel dizzy or have loss of balance, feeling that the world is spinning, etc. And so this program, again, similar to Dawn's, is looking at a home-based program that people can undertake themselves in their own home, compared to people that are attending regular physiotherapy undertaking this type of rehabilitation, to see the effectiveness of those two different methods of delivering that vestibular rehabilitation.
We have a question from someone watching in Brazil that I'm wondering if you might comment on. They'd like to know whether yoga and Pilates can help improve or preserve mobility.
So there are a couple of studies, some in yoga and some in Pilates. And the Pilates studies have looked at people both who are ambulant, but also people in wheelchairs. And there are some positive results in terms of the benefits that they can bring in terms of people's well-being, but also in terms of their mobility. I think like all these forms of exercise, you need to keep sustaining them. So one of the key things is doing an exercise that is enjoyable and that you're working moderately hard at and doing it in the long term. So if yoga and Pilates is the thing that works well for you, then that seems to have good benefit for people.
I think some people have found that neurologists don't always consider physical rehabilitation as part of treating MS. So what's the conversation that someone living with progressive MS should have with their neurologist?
Yeah, I think it's important to have a really try and have an informed conversation with your neurologist. As you said, some don't recognise that physical rehab can be effective, but there's growing evidence that's effective. It's a matter of asking the neurologist, really talking about the symptoms you have and see if there are non-pharmacological, so rehabilitation style strategies that might be available, and that usually referring to an allied health professional like a physio or an OT or a psychologist or a continence nurse, people that are undertaking interventions that are evidence-based within their field, because there's such a wide range of symptoms. It's impossible for the neurologist to know, all the evidence available. So it's trying to say, would referral to another professional be helpful? And in order for them to ask the person that's knowledgeable in that field, really. We did an audit in our clinical practice and we were really surprised, actually, that the referral rate to professionals such as physios and OTs was much lower than we expected. And so sadly, but it may be true, that the patient might be the person that might need to prompt the neurologist to think about that, because they've got a lot of other things to think about as well. So maybe a gentle prompt would be helpful.
Dr. Gold, how has our understanding of MS-related fatigue changed over the years?
Well, I think the biggest change in terms of how, from a research point of view, people have started to look at fatigue is trying to understand the different forms that fatigue can take. So I think, when I started in the late 90s, mostly it was a questionnaire that asked you, well, in the last 2 weeks or in the last 4 weeks, were you fatigued or not? And I think this is useful as a broad clinical impression, but it doesn't really tell you a lot about what kind of symptom this person is experiencing in their daily lives. And it might even be hard to remember what it was like in the last month, depending on whether you're having a good day or a bad day, right? So I think understanding that fatigue is not necessarily fatigue, it has these different components which have different underpinnings, both biological and non-biological, I think is a big step. And there's been some intriguing evidence coming out for the biology stuff, for example, that a fatigue that comes and goes is different from one that is sustained. So there is, and it would make intuitive sense that these require different treatment approaches, right? So I think this is something that happens, and in terms of assessing and characterizing the symptoms, I think there's a lot of development that has been going on to try to tap into that in the actual real world where the patients are living it and experiencing it. So you get a better sense of how and when and where this is interfering with their daily lives and what you can do about it. Unfortunately, in the last decades, there hasn't been too many sort of new pharmacological treatments, and this is certainly something that we ultimately would hope that this research into the biological basis will help to develop new and more effective drugs that could help manage that. But there has been a lot of stuff going on with innovative rehabilitation strategies. And I think I can only echo what Don and Jenny have said, is that these sort of multimodal approaches using different strategies that is effective for cognition and for pain and for it's usually because it's exactly that combination that will also affect different aspects of the symptomatology. And I think one thing that I'm particularly pleased about is that, and I think Jenny alluded to that, rehabilitation trials used to be in some specialized center, 10 people randomized, it works like a charm with this particular therapist in this particular center for these particular patients who were in this particular trial. And sort of scaling it up and making it available at a broad scale has been a real challenge, because often you don't have the professionals in rural areas or whatever place you're in. And there's a real big chance for technology-based things, and we alluded to some of them. Some of it is telemedicine, some of it is making, communication strategies available, like we're doing right now, but also sort of creating programs that people could use when they feel or when they have the energy to do it, right? Because the classical thing, you go on a Friday night or Friday afternoon, you have your appointment, and that can get difficult, especially if you have pain or if you have fatigue or if you have mobility problems. So if you leverage technology so people can access these programs when they feel they have the energy to actually do it, then that I think is very helpful.
Makes sense. Tell us, what is your research currently focused on?
So I would say I have two lines of approaches in this particular area. Fatigue is not the only symptom I'm working on. I also have sort of the cousins of fatigue. So we work a lot on mood and depression and things that are always closely related but not the same, right? And I think there's always a very important distinction to be made. And a lot of it is trying to understand what the psychobiological interactions are that are contributing to these symptoms. What are the triggers, what are the maintaining factors, what are the alleviating factors, and how can we leverage that? And is there something to be learned from the biology? And that's the ultimate goal, I think, to integrate the behavioral and the rehabilitation and the pharmacological approaches to really attack this problem from all sides. And I think my colleagues have alluded to that. The other things that we've been doing is, and it was trying to deliver the things that we already know work at a broader scale. And we've conducted a couple of larger randomized control trials for both fatigue and depression with sort of app-based things or enhanced apps, so that you have an app, but you also have another person on the other end of that app that would help you or coach you through, because we know maintenance is really something, you have to keep at it, and it's often hard. It's already hard for everybody else, but it's particularly hard if you have fatigue or if you have pain. And I think to trying to figure out where can we help, using the scalability of this technology, but adding the human factor, which is really, and also connecting with other patients, I think, with connecting with other people who are going through the same thing, leveraging that power of technology in the good sense and not, you know, there's always a big talk about the dangers of technology, but it also offers a big opportunity to get connected, like today, where we're probably having people from at least 5 continents, I would say, listen to us.
Well, one of those people is watching in the United Kingdom, and they've submitted a question to us. Since you mentioned that your interest is also in fatigue's cousins, mood, and I'm wondering if you want to field this one. Their question is, brain fog and depression are a big part of their secondary progressive MS symptoms. They're on antidepressants, but they're not feeling any better. What's your advice?
Okay, so I think, so with those 2 symptoms are closely correlated, but they might not have the same cause, right? So, I think even if you look at depression, it consists of different parts. Part of it is sort of these, you know, depressed mood, but it also has a lot of things that are very similar to fatigue. You have sleeping problems, you have concentration problems, and it depends really what is the actual combination of symptoms that you're having, because the treatment for some of them might actually exacerbate other things. And then you might want to talk to your doctor to adjust your treatment because it's helping you in one aspect, but making something else potentially worse. So this is the first thing, I think. And the second is that you probably should try to understand which symptom affects me most at what point during my day. And is there something I can do about that? Is there a specific trigger that I could try to address? And sleep is always something, because it's connected to both things, but it's different, but it makes both fatigue and depression worse. So try to get rest at night, put that cell phone far away from your bed, try not to watch TV at in the end of the day, you know, dim the lights. And there's something we call sleep hygiene, you know, sort of make it easier to get rest, because that will take away a lot of these factors that are not fatigue per se, but that make fatigue and depression potentially worse.
Where do you see treatment for fatigue and progressive MS heading? What might future treatments look like?
Well, I think my big hope is, especially with an initiative like the Progressive MS Alliance, I think the really big goal is to understand, is there something specific about the fatigue that people in the progressive stages of MS are experiencing? Is that biologically something different that would require a different kind of treatment strategy? And I think because this living a full and active life, and I can only echo what has been said before, I think is always important at every stage for people with or without MS. So I think it's always really important to stay engaged and look after yourself. But if there's something that changes biologically, it will require a different therapeutic strategy. And I think here we really need the input from all people. We need sort of from the cellular biology to the rehab, to the patients and any stakeholder, because we can only address these super complex, intertwined symptoms in the collaborative effort. And I think this is really where an initiative like the Progressive MS Alliance is urgently needed. And I think it will deliver. And I really appreciate the new initiative on well-being, because I do think it's a really important thing that needs to be connected to the biological. It's not 2 distinct worlds. Those 2 worlds need to work on the problem together.
You know, we haven't yet talked much about cognition. Dr. Eadie, what strategies can people use to help with cognitive challenges?
Yeah, so I think some of them that you can use, you've already heard about, and probably one of the most important things you can do is to really take good care of your health and to engage in healthy habits, things like exercise as best, you know, as we've been describing here, you know, getting good sleep, connecting with others. We also know there's kind of 2 other avenues I'd like to briefly mention. One is called cognitive rehabilitation, and that's something the Progressive MS Alliance is really, as you've heard, putting a lot of energy into, because there's really promising evidence that teaching people ways to compensate for or approach how they approach cognitive tasks, things like memory problems, processing speed, there are strategies that are showing good promise for improving cognition in people with MS. So cognitive rehabilitation, now that often requires seeing a professional, but fortunately a lot of those strategies are now being delivered via distance technologies, as you've heard. The other thing I want to mention, because it's something people can do right now, and that's called enrichment, really trying to engage your brain, your cognition, by doing things that are interesting, that are stimulating, that involve curiosity or challenging or problem solving. So that might be doing things like reading, developing new skills or crafts, engaging in music, learn a new instrument, interact with other people. All those kinds of things that get you to use your brain, we think, may slow or lessen the impact of cognitive changes and certainly will enhance your life.
Dr. Gold, what might you add to Dr. Eadie's comments?
I think that was already pretty comprehensive. So I think that one thing that we have learned from a lot of studies is that the more you keep active throughout your life, the more you are able to withstand whatever life or biology throws at you later on. So I think it's really important to enjoy these things all the time. And even if you have, find these little slots in your busy schedule to make time for them, because they will ultimately not only be really enjoyable, but have a potential benefit. And one thing I really want to add, because I don't think I've talked a lot about biology changing things and causing symptoms. I think one thing that we have learned is if you approach it from the other end, if you increase activity, it might actually act back on the biology. So there is a potential for a lot of these things to not just help you manage symptoms, but potentially, and there's some studies beginning to show up, that you can start seeing biological changes with these behavioral interventions. And I think that's really exciting. And it's all the more encouragement to try within whatever limitations you think you have to stay as active as you possibly can and stay as connected as you possibly can.
Okay, let's go around one more time on some things people can start doing now that will help them better manage the symptoms that we've been discussing and improve their well-being. Dr. Freeman?
Okay, so there's been a lot of emphasis on increasing physical activity, but that is something I'd like to emphasize as well. But I'd like to say, don't feel that you have to start at a large amount. Start maybe in the first instance of what you can do on your bad day, and then build up from there. But keep it going each day, so that if you start at what you can do on your bad day, you can always achieve that. So build up upon it so that you really try and have more exercise, but also be less sedentary. So sit down less. Maybe even, in the ads of the television programs that you enjoy, perhaps do some standing up there. Anything that you can think of that begins to get you moving a little bit more, and you can start that today.
Thank you. Dr. Eadie?
We've heard about a lot of different strategies, and there also will be resources at the end that you can learn some others, things like moving more, connecting with others more. I think what I want to emphasize, that one thing that you can really do is see this as really developing good habits, because a lot of these things that we're talking about, if they're going to impact your symptoms in a positive way, you're going to have to make them part of your routine, and you're going to have to make them really just a habit, a good habit, a healthy habit. And I think starting small is a good way to start the development of those habits.
And Dr. Gold?
Okay. Well, I think these were all really, really helpful suggestions. And one thing that in the approaches that we're pursuing here is a component that's always in there, is try to find or develop a sense for the times when you can actually do these things. So, and then seize them. So, you always have a good part of the day and a bad part of the day. And it's important to start to understand your own body and your own environment, and trying to figure out where is the spot or where's the time slot where I can do something, and then seize that opportunity, because instantly gratifying to a certain extent, and then it's also helping you to increase these moments more and more. The more you have them, the more active you stay during these times, the more of these moments you will have, ultimately, I think. And it's basically the flip side of what Jenny was saying. Make sure that on a bad day, you do something, but also on a good day that you make the best of that good day that you have, and sort of.
Yeah.
And maybe I can ask one more question of the three of you. I'll start with you, Dr. Gold. What can the International Progressive MS Alliance do to move our understanding of enhancing well-being for people living with progressive MS forward and result in better treatments?
I think one thing it has already achieved, and I'm always really impressed when I go to the meetings of the Progressive MS Alliance, is that it started, or it has people getting to talk to each other that work on the same problem but don't know that's what they're doing. So I think to connect people who work in cellular biology with physiotherapists is a very important point, and this was something that has been already created. So that goal, I think, has already been achieved. And then now we need to use this momentum to actually create the kind of advancements in understanding and sort of new strategies. And this will always require the motivation and the effort and potentially research funding, as always, to move that forward. But I think getting started, and I think it's echoing what we said before, getting started is the hardest part. Keep going is also important, or very important. But if you've already started, that makes it easier. And I think that's something that we have already achieved. And I'm really looking forward to where it might be leading in the next coming years.
Dr. Eadie, could you comment as well?
Yeah, I echo what you just heard, but I'd also like to add that I'm really excited about the fact that the Alliance has brought people together, including people with progressive MS, to focus on these symptoms, because they have been very overlooked in our science. I think certainly there's people doing work in these areas, but it's really exciting that there's such a push and a rallying call to try to address these complex symptoms.
Dr. Freeman, how about you?
Okay, so you've stolen everything I wanted to say, of course, but I guess to say that to keeping progressive MS in the spotlight, because it's easy for that to dwindle with increased pharmacological agents, etc., available. So that's to keep doing that. Don't take finger off pulse in terms of that. And also I think events like this are fabulous to be able to I know we're not hearing people as such with MS, they're having to suffer listening to us at the moment, but to be able to have forums such as this where people from every part of the world in different places can really share in the information that's available, I think is something that I'm really impressed with in terms of the Progressive MS Alliance as well.
Well, we're reaching the end of today's Facebook Live event. In a moment, we'll provide a list of online resources that can be used to improve overall well-being and manage symptoms in progressive MS. I'd like to thank our wonderful panel of experts, Dr. Jenny Freeman, Dr. Dawn Eadie, and Dr. Stefan Gold. Your research represents more than hope. It's progress in helping people with progressive MS live their best lives. And for all of you that have joined us today, thank you for being part of the International Progressive MS Alliance and its mission to accelerate life-changing treatments for people with progressive MS worldwide. Your support and engagement is essential to our success. And please mark your calendars for Thursday, February 20th. We'll be holding a global webcast on one of the Progressive MS Alliance's drug discovery collaborative research networks. Now, this research is paving the way to treatments that can protect and repair nerves in progressive MS. It's going to be both informative and inspiring. As promised, here are some of the online resources to use and share to increase well-being and help address challenging symptoms in progressive MS.